You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we are joined by ONS member Diana McMahon, Director for Professional Practice at the James Cancer Hospital and Richard Solove Research Institute, a part of the Ohio State University, and member of the ONS Columbus Chapter, to discuss multi-generational workforces and how to best manage diverse staff to work together to provide optimal patient care. Diana, thank you for joining us today.
Thank you for the invitation.
So to start us off, why is it important for nurses to have an understanding of multi-generational workforces?
As oncology nurses, we value caring relationships, and we realize they are essential to our practice. Not only relationships with our patients and families, but with our colleagues and teams. Building trusting and respectful relationships require an appreciation of a person's attitudes, values, and behavior. This is one reason that discussing our multi-generational workforce is important. It is key to developing healthy relationships that ultimately can enhance the quality of care we provide to our patients. Relationships are also an important component of our professional resilience. Nurses frequently work 10 to 12-hour shifts. Peer support can help us build resilience, which is essential as all nurses experience work-related stress. It is vital to leverage our colleagues' strengths, skills, and support to enhance our own well-being. But the literature confirms that generational differences related to communication and teamwork can also contribute to that stress and influence our job satisfaction. Understanding unique generational challenges will allow us to proactively build a supportive environment for nurses to thrive. I do want to acknowledge that our nursing leaders face a considerable task of developing and supporting staff from multiple generations that have different values, work ethics, characteristics, and personalities. To further complicate these challenges, there are unique differences between individuals of the same generation. Our leaders are responsible to foster a safe work environment for nurses to provide care. The merging of generations can create challenges such as interpersonal conflicts, low productivity, and communication misunderstandings that impact patient care and staff retention. That is why conversations like this are essential. Understanding our multi-generational workforce is important for all of us as we strive to deliver expert, compassionate care and retain nurses, especially as we face a national nursing shortage.
There's a lot in what you just said, and we're going to break that all down throughout this podcast today and talk through some of those things. How many generations make up the current nursing workforce for today?
Our current nursing workforce is represented by 4 generational cohorts with unique characteristics that define their work ethic and their adaptation to a professional role. But please remember, characteristics are not good or bad. They are just generalized tendencies based on life experiences, family culture, social influences, technology, and communication. So learning to leverage each generation's skills and strength is crucial. I want to talk briefly about the 4 generations in our workforce. However, be aware that the dates we use to define a generation are somewhat subjective and they're inconsistent in our literature. So if you're on the edge of a generational timeline, you need to decide where it's a best fit for your experiences. So let's start with the baby boomers. Born roughly between 1945 and 1965, they are known for their strong work ethic. While they are optimistic, adapting to change can be difficult. This generation may be a bit slower to integrate new technology into their workflow. Their strengths include clinical expertise, organizational loyalty, and a willingness to put long hours into successfully completing a project. Because of the diversity during this period of their history, we'll note that the earlier baby boomers were considered trailblazers with access to new and exciting opportunities, while the later boomers had to learn to compete among the former cohort's demand. So even in this cohort of this generation, there are major differences. Until recently, this group outnumbered the other generational cohorts in the nursing workforce. we are starting to experience a passing of the generational baton, and we'll talk about that in a bit. The next generation is Generation X, also known as the latchkey generation, and their ages range from 35 to the mid-50s. These individuals are independent, adaptable, task-oriented, and resilient. They expect and provide immediate feedback and may question the rules. And although they are loyal to their work settings, they also highly value family life and expect a good work-life balance. They are good problem solvers, and they are ideal for clinical practice and also quality assurance positions. Then we look at Generation Y, or our millennials. They were born between 1980 and 1995. This generation is motivated, but may need frequent validation. And while they're very self-confident, they are also sensitive to criticism. Millennials enjoy collaboration and prefer to learn through experimentation rather than just reading. This generation makes good team members who adapt quickly to new technology. Organizations need to consider that within the next 7 or 8 years, this group is estimated to represent 75% of our nursing workforce. And then finally, let me introduce you to Generation Z, because we're just starting to see them in our workplace. They're the youngest generation of nurses, and they were born with a variety of technologies in their hand, and it has infused all aspects of their life. They are confident, social, and optimistic, and have mastered online social relationships, which sometimes can challenge their face-to-face communication. This generation can multitask, and they desire immediate communication and feedback. They are creative and flexible, so that an innovative technological approach are a perfect challenge for this generation. And while we don't see much research about Generation Z at this point, I look forward to seeing more in the future.
Thank you for going over those. That was a very detailed description of the different generations. And even in that description, you gave us some of the differences that they all bring to the workforce. How has the generational diversity in the workforce changed in the past 50 years?
This is an interesting question, because I just mentioned that until recently, baby boomers had made up a significant portion of the nursing workforce. But with more new graduates entering the profession, we are starting to see a generational divide that requires some attention. What we do know is that as one generation decreases in number and another takes the majority, a culture shift starts to occur. This shift might require operational changes to account for work styles, or new benefits and resources to attract the younger generations. Currently, we have seen a significant prioritization of work-life balance. Generation X's and Y's may require hospitals to look at a more flexible scheduling as our baby boomers retire. Since we have identified and labeled 4 unique generations living and working together, we must be willing to use this information to improve our work environments. It requires us to pause and assess how we can individualize education, hiring, and support based on what we know about our generational cohorts. For example, as generational diversity increases, the need to enhance our orientation experience and tailor to our newest nurses has become well publicized. I grew up very comfortable sitting in a classroom listening to days of lecture to learn about the care of oncology patients. This is not the preferred way of learning for our new graduates, so I need to leave the comfort of my preferred learning method and engage the new generation of nurses in learning experiences that are meaningful. And I might have to do this for more than one generation. So accommodating different generations require flexibility and resources in understanding the historical nature of these generations.
That is so interesting. As I'm thinking back to how you were describing the generations early on and the baby boomers not liking change, but realizing about even the orientation and how that change has to happen, learn about and think about how we do things differently to bring that those new generations along. What differences related to values or professional goals and successes do you see in workers who belong to the different generations?
A 2015 report suggested that nurses of all generations are more similar than different in their career focus, expectations, and needs. That might surprise us, knowing what we know about the different generations. But each generation also brings to the workforce varying personal and professional strengths and challenges. In 2019, the Journal of Nursing Administration published an article called Cultural and Generational Considerations in Nurse Retention that focused on emergency nursing workforce changes. One of the things that they looked at was the estimated numbers of years that a nurse planned to stay with their current employer. Baby boomers averaged about 8 years, Generation X about 6 years, and our millennials only about 3 years. But when they were asked what the hospital could do to retain them for the next 5 years, the respondents, regardless of their generation, focused on pay, staffing, and nursing leadership support. This was one study at one hospital, but many of us were experiencing similar trends. This study also looked at nurses' preferred leadership traits and found that all generational cohorts wanted supportive, approachable, respectful leaders who demonstrated professionalism and advocacy. The researchers did identify that Generation X and baby boomers found good reasoning skills necessary, while the millennials prioritized a leader with clinical competence. Another interesting difference is that the millennials and the baby boomers preferred leaders who were empowering, while Gen Xers wanted mentors. Finally, we are seeing our younger generation of nurses wanting to accelerate their career growth faster than in previous generations. My organization has found that our clinical advancement program has grown significantly in the last 3 years as our new nurses are eager to advance their career.
Thank you. And how about similarities no matter what a nurse's age? You spoke about some of those in what you were talking about in that last report, but are there any additional similarities that you have found?
Well, thank you for asking that question. I think there are many similarities between nurses, no matter our age. And while we discuss their homogeneous kind of respect for authority and there's desire for a strong relationship with their leader, there are a few other things that are pretty important. I think my favorite commonality among oncology nurses, regardless of our generation, is that we are passionate and compassionate professionals. We tend to be deeply committed to the art and the science of nursing. I think we all agree that our patients require highly specialized nursing skill, complex treatment modalities, and a caring relationship with their nurse. Often oncology nurses have a story of what drew them to our specialty. Maybe it was a family member or a friend who experienced cancer. During orientation, I know we ask our nurses what brought them to oncology. This conversation helps us to start developing a relationship. Once you know a little bit about a person, it's much harder to discount or treat them rudely. These stories are motivational and give us a shared experience despite our age. Oncology nurses are also extremely self-giving, sometimes at the expense of their own well-being. That is where resilience comes in, and I give the younger generation of nurses kudos for bringing this agenda to the forefront of our healthcare. Sadly, all generational cohorts experience burnout. Again, maybe for different reasons, but if we are not intentional about developing a self-care routine, the literature tells us that about 40% of us will experience burnout that could end our career. The literature also suggests that our new nurses are more likely to experience job stress than older nurses due to their lack of confidence or competence and continually entering into new situations. On a more positive note, nurses value lifelong learning. This is one of the reasons I enjoy ONS podcast. Who thought a baby boomer would say that the podcasts are currently their favorite way of learning? I need to give my millennial colleagues a shout out for introducing me to the magic of podcast.
That's great. I think that was really interesting. And I agree with you. There are so many more similarities that we do share, and that brings us together despite the generational differences.
And I just think it's important to acknowledge those because we spend a lot of time looking at our differences and finding the negative aspects. So that's why that was such an important question.
I agree with you. I think it's so important to focus on the positives and what we do have in similar. So, what are some of the benefits with having a multi-generational nursing force?
Well, obviously, this diverse workforce is our succession plan that is crucial for not only our professional sustainability, but for the patients we serve now and in the future. So it's our lifeline as nurses. But multiple generations in healthcare also reflect the patient populations we serve. So equipping our teams to better care for a diverse community. But our generational diversity can also make us better clinicians with a deeper understanding of our colleagues and our patients' experiences. A multi-generational workforce provides an increased diversity level, keeping us contemporary. It allows us to evolve as individuals and as a profession. It challenges us and doesn't let us become stagnant or maintain a status quo. We are continually striving to be better. COVID has brought us a phrase that we hear often, and it's "we are better together." But I think this really applies to our multi-generational workforce. We are truly better together.
I like that phrase. I think that is very important. And it's so important for us to be able to recognize that we all have something to learn from each other, and we all bring great experiences and new ideas and things to the table to help us work together as a better nursing force for our patients. In looking at working together with different generational peers, what's some advice or some challenge that you can give to us in those situations about challenges that you might have and how to overcome some of those challenges?
This is a great question, too. I have Gen X daughters, and so Gen Z daughters, I should say. And they would say, I love to advise people and tell them what to do since I'm a baby boomer. But since you asked, I'm going to share. I would advise nurses to educate themselves and become generationally savvy. This is no longer nice to know information, but vital to our careers. We need to commit to understanding the experience that frames another's worldview. We are egocentric beings by nature, so practicing self-reflection can enhance our self-awareness and should always precede any attempts we have at trying to fix a colleague who has different values. Being vulnerable and walking alongside a person with a different experience of the world can be challenging, but it can be empowering at the same time, so we have to be brave. Our cultural values are formed in childhood, so our natural characteristics are rooted in experiences that we are often unaware of. So we need to be gentle in our judgment of ourselves and of others. I will share one of my challenges as a baby boomer. Typical of my generation, my work is extremely important to me, and I will sacrifice personal interests until I get my job done. I know I can quickly burn myself out. My Generation X and Y colleagues are equally productive and dedicated, but they have a different work style. I am just learning to work from home. I prefer to use my hospital office even during the height of COVID. My colleagues are helping me to understand that there are times that working off-site might be more productive. It's not being lazy. It's being productive in a different way. And while I'm trying to learn something new that feels uncomfortable, I need support, not judgment. We have to use our differences to learn and grow. And I'm grateful I have younger colleagues who are willing to mentor me in areas that I need to grow.
That was a very good example. And I think you're right, especially with everything that has gone on with COVID, how important it is, and just being able to look at the differences that we have and the similarities and things like that. One of the things that you mentioned earlier was that we really need to focus on the positives and the similarities that we have instead of the differences. And that brings me to the next question. When we're talking about these different generations, a lot of times there's stereotypes that goes with a specific generation versus a different one. So, can you talk about what some of those stereotypes might be and how can nurse leaders work to eliminate these stereotypes?
If you had asked me this question a few months ago, I would have answered it completely different. But I believe our current pandemic of racial injustice has given us the opportunity to reflect on who we are and who we want to be in society. While we know stereotyping exists, we must stop and consider how our own stereotypes impacts our behavior at work as professionals committed to a caring and compassionate work style. I recently heard stereotypes are a bit like air, invisible but always present. And while it may seem like we should just stop paying attention to stereotypes, it isn't easy. We look at differences and we start stereotyping. However, I think there is hope. Emerging studies on how to reduce stereotyping have identified a range of methods. The most obvious is being committed to stopping all stereotyping. And while we're working towards this goal, there are a few techniques we can use. And I'm going to give you some examples of stereotypes we might have and how we could use some of this work. One idea is to celebrate a colleague's generational strength. It demonstrates a community appreciation of a trait that might be unique to this cohort. It also gives us a chance to learn and appreciate this characteristic. This makes me think about how we use peer feedback as professionals. This is often a very hard concept to integrate into the work setting because some of the challenges we have generationally, our communication doesn't work real well. But what we know is that Generation X expects and provides immediate feedback. So who should be the champions for this work? Definitely Generation X. We also know that Generation Y may be sensitive to feedback if they perceive it as criticism. So we're going to be very careful when we're making up this curriculum to make sure our feedback language is not critical. Another idea is to assign patients and unit projects based on an individual's strengths, not just their seniority. Generation Z has the experience and passion for helping our organizations to develop virtual communication for our patients as visitors are limited in our buildings due to COVID. They can help our older colleagues become more comfortable with this new communication method. And maybe those of us who aren't as comfortable with this, who used to complain about everybody's cell phones being out, all of a sudden we see the value of our younger generation who just naturally can pick up these devices and figure them out. Or think about if we put together a multi-generational education team so that nurses learn firsthand from the generational experts. When we tell our stories, when they're stories and they're not lists of strengths and weaknesses, but they're stories about our life, we learn about our differences, but we also learn ways that we can integrate our differences to make us stronger. Nurse leaders can also help the staff focus on individual strengths when they're providing coaching. So this is a conversation I just heard in my organization. And the nurse manager said, I appreciate your ability to adapt to all the recent changes we've had in technology, especially with the addition of virtual patient and family communication. I would really like you to be our unit technology champion to support colleagues who may need additional assistance learning these devices that we're going to continue to roll out. This was a very young nurse. She was still developing her clinical competence, but identifying and promoting this skill will increase her confidence and visibility as a team player. Leaders can facilitate relationship building among those with generational differences. They just have to look for the right pairings. This leads me to another way our leaders can help eliminate stereotypes. Building a safe environment where all staff can gain confidence in practicing otherwise threatening skills. Leaders can help reframe tasks that are challenges and provide practice opportunities. Let's face it, our fast-paced roles, we expect competence in every area immediately when they're introduced. Our generational experiences help us to acknowledge our strengths and differences, but we have to think about those before we implement new tasks and procedures and policies. I want to mention one more common point of stress in our daily workflow. It's communication. Baby boomers and Generation X prefer direct communication, maybe a phone call or an in-person discussion, while Generation Y and Z colleagues are more comfortable giving and receiving information via text. An older colleague may assume that their younger colleague isn't working or is just avoiding them, when it's just a simple preference. It's the way they've learned to communicate. We have to develop respectful communication plans to meet the strengths of our multi-generational force. But first, we have to understand them.
Well, that brings me to another point. You're talking about understanding the differences in these generational employees. Is there something more or different that you would say to a leader on managing these diverse workforces? Because clearly you really need to have a good understanding of the differences in the generational, their priorities and values, to be able to manage them well. And you did give an excellent example of the very young nurse who was not having her confidence in her clinical skills yet, but her other skill of understanding technology and being able to use social media and social technology to reach out and work with families and how that manager found that and asked her to use that expertise that she had to help others. So, are there any other things that you might suggest for managers on managing this diverse workforce?
First, our leaders just need to acknowledge our diverse workforce as a crucial challenge and just admit it that it's out there and the challenges can be good. I also think our leaders must commit to continuous learning about the multiple generations that they're caring for. Just as we expect our staff to be experts in their patient populations, our leaders need to be experts in our staff population. And there are a few things, just quick bullet points that they can do. They can engage in learning implicit bias, not only for themselves, but for their colleagues and their staff. And they can develop strategies to minimize these biases that they have. We need to work with our staff about their biases also. It's sometimes very natural language comes out and it's not at all what we mean. But that takes some time and some education and it takes some practice. But it can decrease incivility and increase a workplace environment that is positive and helpful. If we choose to lead from a strength-based framework, we can leverage each nurse to improve our unit, environment, and patient outcomes. So, for example, here's a few other things we can do. We can find a baby boomer to share their clinical expertise before they retire because they're full of expertise. We can assign Generation X staff projects that they can work independently when possible, as being micromanaged is often very discouraging to them. And millennials, they can lead technology changes with confidence because they enjoy it and they enjoy teamwork. And I always think if you're looking for a creative approach to a clinical problem, pair a Generation Z nurse who tends to be very creative with a baby boomer who's an expert. What a great team coming up with a plan of how to care for a difficult patient or an unusual case on your unit. Nurse leaders are responsible for assessing and determining areas in their sphere of influence that is impacting job satisfaction and intent to leave. However, we also need our organizations to provide resources to assess and educate our nurses. So advocacy from the leaders is crucial.
Such good points. Thank you. What are some things about multi-generational staff that are not often discussed, but you wish people knew more about?
I wish we talked more about implicit bias and how it affects us individually and our relationships. If we're willing to engage in the work of understanding our own biases, we can do something about them. We need to reflect, learn, practice, and ask for feedback. We can change our behaviors, but we have to know what drives us. I think this is crucial. And I know as oncology nurses, we have a lot to give to these crucial conversations because we value relationships and compassion as part of our patient care practices. So we have the expertise to share.
Do you have any recommendations on resources for multi-generational workforces?
Well, as oncology nurses, we're committed to evidence-based culture. So let's start with the literature. I think our literature is filled with research and evidence-based practice and case studies that we can take and use in our settings. We don't have to reinvent the wheel, but we have to be proficient at looking at the evidence. We've discussed team building a little bit, how important it is, but the web is filled with activities that increase mutual understanding, communication, and respect. And one of my favorite activities takes less than 10 minutes. And you can learn so much about a colleague. We split people up into pairs, our nurses up into pairs, and ask them to find 10 things they have in common. As we debrief this activity, there's a lot of laughter, and you can see and hear the relationships developing. The web also has access to multiple implicit bias tests that can help identify areas of bias that we weren't aware of. I know my human resource department has coaching and communication resources for individuals, so I encourage people to look at their HR departments. But I think the most valuable resource we have for our multi-generational workforce is our content experts. Consider developing a multi-generational workforce advisory committee with a couple of representatives from each generational cohort to engage in continuous learning and advising of our leadership and to help with our organizational initiatives. This practical concept demonstrates a commitment to address workforce needs holistically and comprehensively while providing mechanisms to efficiently initiate change management.
Diana, you've given us some great information today, all the way from the definitions of the different generational groups that make up our nursing workforce to today, to the similarities that we do have among those generational workforces and resources. Do you have any final comments about the multi-generational workforce that you'd like to share with us today?
I think discussing the challenges and the strengths of our multi-generational workforce has to be part of the nursing agenda if we're committed to building a robust and confident nursing workforce. We must be continually looking for and building evidence to implement programs. We need to remember that as oncology nurses, our commitment to our patients and families begins with a commitment to each other and understanding each other. And using our multi-generational colleagues' strengths will grow us individually and as a profession. So cultivating an environment of open-mindedness and inclusion is crucial to this work, and it's all our jobs. So let's just keep this dialogue going. I just want to thank you for letting me join my ONS colleagues to talk about this important and timely topic, but we need to learn from each other. No matter our culture, our generation, we just need to keep the discussion going. So thank you.
Diana, thank you. And I just want to leave us today with a slogan or a phrase that you mentioned earlier, and that is, we are better together. And I think at this time in our nation and just how everything is going, I think that's a great thing for us to remember, and working with our peers across the generations. So thank you.
Thank you so much.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.